So my name is Daniel Marks. I'm an attorney at Flaherty and Hood in St. Paul, Minnesota. And I just want to welcome everybody today to kind of a joint discussion hosted by the Minnesota Environmental Science and Economic Review Board and the Coalition of Greater Minnesota Cities. And we're talking about the Memorandum of Understanding related to PFAS monitoring program that's been proposed and developed by the Pollution Control Agency. And the impetus for this meeting is that the PCA sent out a draft MOU for people to review, and I was getting lots of phone calls and questions from different people, members of MESRB and CGMC. And so we thought that it would be a great idea just to host a little overview meeting so that we could talk about the presentation, talk about the MOU, and go through it a little bit line by line here. So I'm going to start off. We're just going to do some basic introductions. And so I would like to just have the MESRB officers that are on the call, and MESRB's president, Josh Gadd, introduce himself, if you can, Josh. Or you can just wave and say hello. There you go.
Good morning. Josh Gadd, City Mankato, president of MESRB. Thanks for everyone joining in on this call.
All right. And then next, I'd just like to give the opportunity. We have some folks from PCA here today who at the last minute were willing to participate in the discussion and share some information. So I'd love to give PCA the opportunity to introduce themselves as well. I know Nicole Blazing is here. So Nicole, if you want to start, and you can introduce anybody else from PCA. Thank you so much for being here this morning.
Yes, thanks for inviting us, and happy Friday to everybody. We're happy to be part of this conversation today. I'm Nicole Blazing. I'm the Municipal Division Director here at the MPCA, and with me I have Jeremy Lodglin, who's our Municipal Pretreatment Coordinator, Suzanne Bauman, who is the new Municipal Wastewater Section Manager, and Jean Coleman, who's our PCA attorney.
Thank you so much.
Yep.
All right, well, I'm going to go through now. We're going to go through the PowerPoint, and for some reason, I have lost control of the PowerPoint. So Kelly, if you can take control of the PowerPoint and bring us through, give me a thumbs up if you're with me. Awesome. So today, the roadmap for the discussion, we did the introductions. We're just going to talk briefly for those who are less familiar with the issue. What is PFAS? We're going to do a high-level overview of the PFAS monitoring plan and MOU, some of the key responsibilities, some of what MESRB members and the CGMC members that we've talked to this see as benefits of the MOU, and then some of the concerns that we've identified. And then really the idea here would be to spend the bulk of the time with some questions and answers that all kind of facilitate. And I think PCA will be able to answer some questions as well. I think we have to be gracious to the PCA and not expect them to be able to answer everything that we ask. But I hope for just a positive kind of information sharing discussion. And again, this is not about providing legal advice about whether or not people should sign the MOU. I think, again, really this is just responsive to, we were getting a lot of questions from different cities that are affiliated with MESRB and the CGMC. We wanted to host a forum where we could respond to some of those questions all in one place and do some information sharing. So next slide, please. So what is PFAS? Most of you are aware of this at this point, so I won't spend too much time. Furan polyfluoroalkyl substances, the forever chemicals, highly pervasive in the environment, bioaccumulative. They're in all of our blood, they're everywhere. There is a current major regulatory focus at the state and the federal level on kind of the legacy versions of those compounds, PFOS and PFOA. And there are specifically those legacy compounds and several future versions of those present known risks to human health and the environment. And the risks associated with different compounds can vary, but at the bottom line, it is an issue that we should all be concerned about. particularly cities that have an interest in protecting human health and the environment and working to solve these really complicated and difficult environmental problems. Some of the key sources of PFAS in the environment: firefighting foam, industrial processes, domestic products. It can be found and comes from everywhere. One of the key sources that's not listed, what isn't a source, right, is wastewater treatment plants. And if you can go to the next slide, please, Kelly. Municipal wastewater treatment plants are not sources of PFAS. Really see ourselves as receivers of PFASs from other sources. And like I said, those sources can be industrial processes and domestic sources. At this point, these chemicals are in almost everything and everyone. And so everything that comes to the wastewater treatment facility, wastewater treatment facilities receive, right? And so I think for us, from MESSERB's perspective, from the CGMC perspective, it's been really important to communicate to our members and to the public that we are not sources. We are getting this from other sources. And there really isn't presently any good economic and technologically feasible treatment options for wastewater treatment facilities. So the answer really is, at this point, source reduction, first and foremost. And this is a big concern for PFAS, and PFAS regulatory issues is a big concern for wastewater treatment facilities for a couple of reasons. First, obviously, the regulation of PFAS, like any regulation that impacts municipal wastewater treatment facilities, can have significant costs, require eventual treatment and process changes that could have significant capital and operation and maintenance costs. Those issues are a little bit further down the line. The other issue is that, this could result in something that MESSERB and the CGMC are working on very carefully with the PCA in potential changes to the biosolids program. And so really working to ensure that we have a sound source reduction regulatory focus for PFAS that doesn't unnecessarily impact the biosolids program is a key priority for MESSERB and the CGMC. And then there is a risk, both at the state and federal level. The PCA considers PFAS, certainly the legacy compounds, to be hazardous substance under the solid waste and Superfund programs. US EPA is in the process right now of rulemaking to classify those legacy PFAS compounds as hazardous substance under federal Superfund programs. So there is a risk for municipalities, because we own facilities that are point sources that these chemicals pass through, of potential liability. Related to the sources of the PFAS coming from other places. We hope that it will be a low risk. We're doing things both at the state and federal level to look at municipal exemptions to some of those, Superfund and solid waste regulation of PFAS, so that municipalities are not unfairly held responsible for a pollution problem that they haven't caused. Next slide, please. So one of the things that MESSERB and the CGMC has worked to do over the last couple of years is, credit the MESSERB Executive Committee, really at a MESSERB meeting in 2018, really made PFAS a top priority for the organization, and has worked closely with the CGMC and the League of Minnesota Cities and the PCA to really work on a municipal source reduction initiative. Again, knowing that the real problem here is these chemicals entering into the environment. How can we address this at the source? And the priorities of that program have been to prioritize human health and the environment, prioritizing source reduction of PFAS, filling in key information gaps. Where is the PFAS coming from? What can we as cities do about it? The CGMC and the League work to pass key legislation that it impacts this MOU that we're going to talk about as well, that really establishes a stakeholder process for developing source reduction strategies for cities. And PCA, through an independent contractor, is in the process of getting that process moving to really look at how do we address this problem from a city perspective, knowing that the traditional regulatory approach right now won't help us address the problem at its source. So we've really been working to engage with MPCA to really look for reasonable approaches to monitoring, and then what we know will come in terms of eventual regulation of PFAS. And like I said, we're working at, partnering with other organizations to work at both the state and the federal level to look at, municipal liability exemptions. And we're advocating to address PFAS, looking for PFAS funding to address PFAS at wastewater treatment facilities at the state legislature. And that's really the work of the CGMC and the league, and MESRP has played a supporting role. Next slide, please. So as you all know, MPCA released several months ago its PFAS blueprint, and that PFAS blueprint really has a couple of key priorities, which are up on the slide here. I'm not going to read through them, but the one that we're really talking about today is the first priority, which is the monitoring plan. So next slide, please. And the PFAS monitoring plan that PCA developed, it impacts all of PCA's regulatory programs. So we're not just targeting wastewater treatment facilities here. They're dealing with the air programs, the water programs, and the land programs. And obviously what we're focused today is talking about what that PFAS monitoring plan is for municipal wastewater treatment facilities. And this is something, again, that MESRB and the CGMC have worked very collaboratively with the PCA on. And we expressed early on that our preference, right, is to keep this focused on source reduction and really take a stepwise approach so that we're not going towards the kind of traditional regulatory model right away, when really the focus needs to be identifying and reducing the sources of these chemicals into the environment. And so to do that, we've worked with PCA, and PCA has proposed influent monitoring first. So monitoring what's coming into the wastewater treatment facility rather than what's coming out. And that's really important from our perspective, both legally and then in terms of the data collection and how that gets communicated. Legally, we're not collecting data required in the MPDS permit, which has some advantages. But also if we're focused on influent, then we're really looking at what's coming to wastewater treatment facilities so that we can identify those sources and work with those sources to reduce it. And then we're also collecting background information about what's coming to us so that we can show that the municipalities are not really causing PFAS concentrations or causing PFAS pollution. So that influent monitoring was a really critical component of what MESRB and the CGMC advocated for. The monitoring program at this point is limited in scope to about 80 wastewater treatment facilities, with delegated pretreatment programs and significant industrial users, likely all of you that are on this meeting today. And then another key thing that MESRB and the CGMC and other municipal folks really stressed with the PCA is we would prefer at this point to not have this influent monitoring be a requirement as a part of the MPDS permit. And we'd like to do this in a voluntary way outside of the permit. So next slide, please. So this MOU that MPCA has proposed really is an effort to take this PFAS monitoring plan that I think has really been the result of a collaborative effort and try to do it in a way that is outside of the MPDS permit and create some as clear as possible at this point, responsibilities for facilities and then MPCA. So I just want to go at high level overview, and I know most of you or many of you are familiar with it at this point and have seen the MOU. But initially the proposal was to sign the MOU and inventory PFAS sources starting October 15th, 2022. I think that is shifting here, and we'll let PCA talk a little bit about some of the changes that they're looking at based upon feedback from the regulated community. Two, the other key responsibility for municipalities is to develop and submit a PFAS sampling plan. The original proposal was that would be done by December 2022. And then that sampling plan at minimum is going to be doing 4 rounds of quarterly samples with a 6-month break in between the first samples so that you can start to implement some of those source reduction opportunities. Ideally, if sources of PFAS are identified, you can take some time and go back. Sorry, can you go back to the slide that was on there, Kelly? There you go. To actually reduce PFAS before you sample again, potentially showing progress. We'll see how that goes. And then 3, develop a PFAS source reduction and management plan. Many of you are familiar with pollutant reduction or minimization plans. We don't know exactly what the PFAS source reduction and management plan will look like, but I think it would be similar, and it would be reasonable to expect it'll be similar to your chloride management plan, your phosphorus management plan, mercury management plan, things like that. And then really the 4th responsibility is to implement that management plan. And then PCA's responsibilities as part of this, helping establish monitoring and sampling criteria, finalizing sampling guidance for facilities, assisting in developing educational tools, and source identification and reduction tools. And again, part of that is through that stakeholder process that was funded via legislation supported by MESRB, CGMC, and the League. And then number 5 is to develop response thresholds for PFAS based upon the sampling results. And so I understand that to be PCA will start to look at, what levels of PFAS that we're seeing in influent, and at what level should we be concerned, and then require some kind of an environmental response based upon what we're finding. Next slide, please. So again, how will MPCA use the data? I'll let MPCA jump on this as well. But at a very high level, and a lot of this is addressed via PCA's website online. They have a helpful FAQ. But initially, and the focus of this program is to use this data to identify sources of PFAS coming into our facilities, and then working to reduce and remove those sources to our wastewater treatment facilities and our environment. So that's the primary goal and the use of this data at this point. It will also, like I said, inform the development of future response thresholds, which I think from my perspective anyway is kind of an initial regulatory approach response to when are we seeing higher levels of PFAS, what are we going to do? What are we going to consider those higher levels of concern in this early stage of regulation? And then obviously the data collected here will be used by PCA to develop a regulatory framework for PCA going forward, which, and down the line includes potential water quality standards. And there are some of those, site-specific standards and others in development, permit requirements, potential risk assessment and regulation of biosolids in the future. So this data will be used and collected by PCA for those regulatory means as well. And then data is also public, right? So any of this data that gets collected by the cities and by the MPCA will become public data under the Minnesota Data Practice Act. And so it theoretically could be used and accessed for a whole host of other reasons, third parties, such as the media, citizen groups, et cetera, which is another reason that the communication component of this and the influence sampling component of this is so important, because the data that we're collecting at this point is really showing what's coming to wastewater treatment facilities. So that's a very high level. We can address some more specific questions, and I'm sure PCA will have some things to add on that at this point. But next slide, please. So key benefits from MESRB's perspective, CGMC perspective of the MOU approach. And again, we're not trying to take a position one way, should you sign or not sign. This is just trying to provide kind of an overview of what we see as some of the benefits. First is this is geared toward, and the focus is protecting human health and the environment by identifying these PFAS sources, especially potentially coming from unknown sources. So we think that that's an important priority, and it's the right and reasonable focus at this point for a PFAS program. The other benefit is this: I think that this really did result from a lot of stakeholder engagement. MESRB and the CGMC and others worked really hard with the PCA, and I think PCA did and took a lot of what we were saying and offering in terms of suggestions and incorporated into their plan. So I think there really was a ground-up approach as much as possible for something like this. The regulatory focus, again, is on source reduction, requires influent rather than effluent sampling, kind of highlighted that already. And again, it doesn't impose these monitoring requirements or sampling requirements in the MPDS permit at this point. So those are all really key benefits from our perspective about the proposed PFAS monitoring sampling plan and MOU. What are some of the high-level concerns? Next slide, please. So I shared, I believe we shared with you kind of MESSERB's high-level comment letter, and then many of our individual members in many cities have provided feedback to the PCA with more specific concerns. We're not going to go over all of them today, but one of those was, the MOU used the term release related to wastewater treatment facilities. That's a big red flag for us, just because that's a term of art under Superfund law, and we don't want to have that type of legally loaded language in the MOU. A lot of the feedback that we got from cities, and I'm sure PCA has as well, is that the timelines proposed in the MOU are really aggressive and may not be practicable for a lot of local governments, just in terms of getting things executed and up and moving. It's a very complicated new program, and it can be difficult to move quickly, particularly with an MOU, and potentially need city attorney review, all of those things. Another key concern is that it's difficult to obtain accurate PFAS samples. There isn't a validated and approved method for sampling PFAS in wastewater yet. EPA has authorized a draft method to do that, but there's validation studies that are currently ongoing as far as I'm aware, and it hasn't been formally certified. And that's been a big concern about from MESSERB members on the technical side, is monitoring and sampling for PFAS is extremely difficult and complicated. We want, whatever we do, we want it to be uniform and have some regulatory certainty around that. And so we're concerned about the lack of that draft method being validated through these very different studies. And so there's some uncertainty and concerns there. We really see the need for flexibility in the sampling plan in the MOU to, be flexible as changes about how we are, supposed to sample and monitor for these parameters, and making sure that we're using the best available science and methodology to do so. And the other key concern that we heard is that the MOU doesn't have a definite term or expiration date. And that was a key concern identified. Permit lasts for 5 years. The monitoring requirements here, really go over, several quarters, several years. And so looking at the potential for an expiration date is something that we raised with the PCA. And then uncertainty about what process will be used at the state level to develop these response thresholds for PFAS. So we're going to be identifying PFAS and influent. We're going to find PFAS and influent because it's everywhere. The real issue is at what level. And there is a lot of uncertainty in terms of what level of PFAS in particular different compounds, really cause a threat or a risk to human health and the environment. And to identify those is going to take a lot of stakeholder engagement, and there's going to be a lot of uncertainty there. And it's an issue that MESSERB and the CGMC is going to have to pay attention to very carefully and work collaboratively with PCA on. So there's going to need to be a public, transparent process about that. And it's complicated. And one of the key issues is, and we advocated, and PCA, was looking forward to this as well. There were legislative bills about trying to provide funding for this, to either pay for cities to do this or to pay a contractor to do this for all the cities, so that there was some uniform way to conduct the sampling. And unfortunately, that legislation didn't pass. And right now, the cities are going to have to do this themselves and then pay to have it done. So those are just a high level, some of the key concerns identified. Next slide, please. So another key question that we got from different folks is, what happens if my facility does not sign the MOU? And I'll give this answer from kind of my perspective, and if PCA has some answers to this question that they can or are willing to share, that's great as well. But there's no question that MPCA, given the information about PFAS, given that it is clearly a parameter, contaminant of concern, has clear authority to mandate PFAS monitoring and sampling at wastewater treatment facilities if PCA wanted to do that. So they would have that authority. They do have that authority. They could proceed down that route, and other states have done that. Now, if a community decides we don't want to sign this MOU, we're not comfortable with it for whatever reason, I think it's clear that PCA can require you to do that. How PCA will require you to do that is really an open question. It's possible that they would, if you didn't sign the MOU, PCA could say, well, we're going to make this a requirement in your permit and add it to your next permit. They could propose to modify your permit to add this. It would likely require a major modification process, an opportunity for public comment. But the bottom line is PCA has the authority to require you to put this in your permit, and that is clear. And the other potential avenue that PCA could use under their regulatory and legal authority is, because PCA consider these parameters to be hazardous substances, theoretically, PCA could assert some superfund or emergency authority to impose requirements related to PFAS monitoring and remediation actions on local governments. We haven't seen that yet. I have no reason to expect that that's what will happen, but those are tools in PCA's toolbox that they have to protect human health and the environment. So what happens if you don't sign the MOU? It's not clear, but it is clear that PCA could go so far as to require it in the permit, require a modification of your permit to put that in your permit, and then use other authorities to do that. So this is a voluntary program in terms of the MOU. You have the choice whether or not to sign the MOU. If you don't sign the MOU, PCA can clearly come in and require you to start monitoring in your permit effluent. And I think it would be reasonable to expect that that's something they would do if they had a real concern that there's PFAS sources upstream of a wastewater treatment facility that we need to know about so that can be addressed. Next slide, please. So the next steps. My understanding is that MPCA is now in the process of revising the MOU, and will be, my understanding is right now they're proposing to change some of the dates with respect to execution of the MOU, and then presumably push back the dates for the other requirements as well. We'll let PCA talk about that a little bit, but I think at a high level, the next step is PCA will make some adjustments based upon the feedback from MESRB and individual cities, make changes, provide an updated version of the MOU, and then send it back and request that cities execute the MOU based upon the current timelines. Next slide, please. So this, really like to reserve this last half an hour here for questions. And I think what we would prefer, just to make this easy, is to have questions put in the chat. I will try to read them, and then I think I will do a little bit of try to respond to them. I'll give Josh or Marianne or some of the other MESRB officers an opportunity to speak to any question. And then I would like to make sure that we give PCA the opportunity to answer some questions as well. And you probably want to hear from them more than you want to hear from us. So we want to make time to do that. So I'm going to start looking at the questions that are posted in the chat and start ticking through them, and then I will kind of pass them on. So the first question, the slides from this will be available at the end of the meeting. This meeting is being recorded so it can be shared. So everything will be available. I see a question here that says, did I understand the MPCA wanted a month-and-a-half turnaround on signing up on the MOU? I think the answer to that was that was the initial basic proposal from PCA. And I think that that's subject to change. And my understanding is PCA is looking at, changing that now. But yes, there was a fairly quick turnaround, proposed turnaround in terms of signing the MOU, which is something we express is going to be just a practical challenge for cities to do that with different council meeting time periods and all of that. So yes.
Hey, Daniel.
So yes.
Can I don't want to change anything, but I know when you were giving your presentation, you noted a little bit that maybe PCA has, some, overview or something that we could say in regards to, the comments that you went through in your slide. And Jeremy's willing to provide just a quick summary of, what we can share right now. And it might help with some of the questions. Would you like us to just kind of give a quick overview of like what we know so far, what we're looking at, and a little bit more into the email Jeremy sent out yesterday? Or we could do it after the comments.
I think that's probably, that would inform people's questions better. So please do that. Thank you, Nicole, for jumping in.
Okay, thanks, Jeremy. We'll do that in just a minute as soon as he gets unmuted. Thanks,
Sure.
Daniel.
Yeah, I can just give a quick update here. So we appreciate all the time folks put into making comments and helping out with reviewing the MOU. So based on those comments, like we've noted here, we are in the process of doing a lot of updates to the MOU. Largely, it'll stay very similar as far as overall request. Obviously, the timeline is changing. So currently, our goal is to have the MOU finalized and out to folks here probably by the end of the month, and then give you 45 days roughly to turn it around for signature. So there's time for folks to bring it to city councils and have those discussions at the city level. And then the timeline overall will definitely change. We've got some, we are reworking the timeline for requirements and the things that we're doing. A lot of clarifications will be a part of the MOU. We're trying to define more clearly those response thresholds. So one of the things you can think about when we're talking about response threshold is it's a source reduction priority way for us to look at what priorities need to be done based on the results that we get. So we're going to wait till we get the data to develop those response thresholds. So I think what we're trying to do in the MOU is kind of be a little bit more detailed and specific on what those actions would be, maybe to respond to those thresholds. They're not a risk-based threshold. It'll be more of a statistical thing for us to help prioritize working through what we find when we get that data. And then probably a little bit of reordering of some of the requirements within the MOU to maybe help with that. One of our responsibilities is we're still continuing to look for funding. And so we're adding in a clause in the MOU to, if we get some funding that would allow us to come in and do sampling and do the sample collection. So if we do find that funding, that we could have a ability to just use a contractor to come in and do the sampling and do the analytical work for the communities. And so that's part of the main updates that we're doing to it. A lot of clarifications. There's a lot of really good comments on just language and how things like the release or the receiver things. So we're working through all of those updates in the MOU to help clarify things based on the comments that we've got. So I don't know, Nicole or Suzanne, if I missed anything, feel free to add in, but that's the kind of the basic high level changes that we're looking at overall.
Yeah, and Jeremy, thank you very much. Jeremy, Nicole, others from PCA, maybe just take a minute. If there's anything that you think I covered and you wanted to shed some light on or additional information, you know, if you want to take a few minutes to cover anything else, please do. And then I think we'll get into questions.
Yeah, I don't have anything to add beyond what Jeremy did. I just know that there was some items and adjustments that we were making and planning to make as a result of the comments that you guys sent on timelines and some of the wording and additional clarification. And we do plan, when we send out the MOU for signature, we do plan to have, you know, a response to the comments and then an explanation of the changes that we made and how it connects to the comments that we heard. So I just wanted to make sure that you were aware that, you know, we are looking through the comments, we are making adjustments. We thought there was great comments that were sent in, and we are making adjustments from what we heard. But we're still obviously at the beginning stages of all of those changes right now. So I thought it would be helpful to feed into the questions. So thanks, Daniel. Thank
you, Nicole. All right, so I'm going to start ticking off some of these questions. We're getting a lot of questions. So I'm going to, if I see ones that are similar, I might not read your exact question, but just kind of spin through these here. Okay, the first question that I see is, so the question is, so in effect, this is not voluntary. Our hand is being forced by MPCA. You know, please define voluntary. So I'll just take a stab at that. So I think that, as I tried to explain in the beginning, this signing the MOU is voluntary, but the bottom line is that if PCA made the policy choice, either collectively or with respect to an individual facility, they could require monitoring and sampling of PFAS in the MPDS permit. And knowing that from the get-go, Messer really advocated and the CGMC really advocated for an alternative approach from what some other states were doing, where they were taking that more traditional mandatory requirements in permits and advocated for something outside of the permit that wasn't looking at effluent, so what comes out of our facility, but was looking at influent, what comes into the facility. And that we saw that as a key benefit to take a different approach. So it's voluntary, and Elizabeth Whiffle, my colleague, calls it voluntold. But I think from our perspective, signing the MOU is voluntary. PCA clearly has the authority to require this, and they could require monitoring and sampling requirements that from our perspective would be less beneficial to municipalities, and that doing influent monitoring outside of the permit is better than effluent monitoring in the permit. And so I think that's how I would answer that question. It's a legitimate question and critique of the whole process. I don't know if PCA has anything to add to that issue.
I think you did a good job, Daniel, of explaining it. And when we had the stakeholder group, when we were developing the monitoring plan, that was one question that we had asked for feedback at the very beginning. Is we have different ways that we could go about working with municipalities to start sampling and working on identifying PFAS within our waste systems, and we have the statutory authority to require it in different ways. But obviously we prefer working together, working collaboratively, and I feel like we can get things done better and faster when we do it that way. And we had heard through our stakeholder process, as you noted, Daniel, that working together collaboratively through a memorandum of understanding where we outline what the expectations are. We all are on the same page. We understand what we're asking was preferred both by us and by the people that, the municipalities that we heard from. And that is really where we are prioritizing our efforts first, is developing the MOU, working in collaboration with you all and wanting to do it together, looking at sources. We do agree source reduction is where we need to start. Identifying and removing sources is the critical first step to, starting down this road or this journey with understanding and tackling PFAS together. So that's where we're at, and that's where we are putting all of our effort right now. We do have the statutory authority, but there's no discussion right now at what that means. What we want is to work through the MOU process with everybody.
All right. Thank you. So another question here is, what is this going to cost for our community? I've heard different estimates about what the PFAS sampling will cost for communities. I don't know if somebody has a more recent figure, but I've heard ranges between $500 per sample to a couple of $1,000s per sample, depending upon what is being sampled. I don't know if somebody else has more accurate information about what the sampling will actually cost in terms of sampling at lab. You have staff time, all of that. But I would estimate that, the quarterly sampling, you could probably expect to spend, $1,000 or more per quarter, and potentially more. And you have staff time and things like that. If anybody has more accurate information, please pipe in.
Sure. If I could just share, I know we've kind of started down this road with our stormwater group as well, industrial stormwater. And so they've been getting estimates from labs on quotes for doing the sampling, which would be very similar in nature. It's the same analysis work that they would do. So just the cost per sample is ranged between about $300 to $500 per sample for analysis work. And typically what you would see is the sample of the influent, and then typically we'd like to see a field blank not required by the MOU, but would be recommended to help with contamination concerns and kind of help get a better idea if you have a good sample or not. So you could say for the four sampling events that we're looking at would be between $4,000 to $5,000 roughly. And that seems to be a fairly on par estimate from what we've seen with the stormwater group.
Okay, thank you for that.
Mm-hmm.
A very detailed question here, complicated indeed. Under the MOU, cities will be required to develop a PFAS management plan, presumably if a source or sources are identified. Do cities have clear authority to require PFAS reductions, or is all of this effort expected to be purely voluntary? This is very different from establishing pre-treatment local limits. I think that's a really good question, and I think it's probably a bit more complicated than can be handled quickly. But at a high level, I think my view is that under the MOU process and the approach that's being taken here is that the source reduction efforts of cities will be working with SIUs and upstream partners in a voluntary framework similar to what cities are working with in PCA. Because this isn't necessarily a requirement in the permit. There may be different authorities and ordinances at the local level. It is going to have to be a different approach in terms of how to handle the SIUs and working with those partners. And I think, again, the hope would be that they would recognize that this voluntary approach where we're working collaboratively to do this is better than a top-down regulatory approach. And so I think that's the intent. And certainly it could be different for different communities depending upon what is found and how much and all of that. But I don't know, that's my initial take. It's going to be an interesting issue that's going to have to be dealt with, certainly. So great question. Any thoughts from PCA or others on that issue?
Yeah, I can just share real quick from the pre-treatment standpoint. That is, most of the time when we think of a local limit, we think of a numerical standard, and that is to be technically defensible. There has to be some kind of standard to build that off of. So that would be a very difficult thing to build a standard like that in. One thing that's also part of a local limit is a BMP or best management practice, which wouldn't necessarily be a numerical value, but it would be a way to develop local standards on expected ways for people to manage things with PFAS in it. So that's kind of a softer route that they could go, but not necessarily, like you said, a regulatory way to kind of manage PFAS. So it'd be more of the voluntary side of things as well with industries until potential limits come into play, and then a local limit can be developed based off of that.
And the bottom line, I think the overarching goal of this program, at least from MESRB's perspective, is we need to get data to determine where PFAS is coming from. And if we discover through the monitoring program that there is an upstream source that has a lot of PFAS, there's going to be different approaches that could happen depending upon how it's coming, where it's coming, and what quantities. And that's kind of an unknown at this point. Another question here, not that I'm advocating for this, but do cities have the option of individual sampling plan approval with the MPCA if they decide not to sign the larger MOU? It's not simply MOU or MPDS modification, correct? And I guess my answer to that question is we don't really know. I think that the preferred approach that MPCA has identified is the MOU approach, and I don't think we know, and I don't know if MPCA knows or is willing to address that question with more specificity, but I'll give you an opportunity to.
I was waiting to see if Jeremy was going to speak, but I'll say something. We again, just circling back to like our preferred approach is the MOU. It puts us all on the same page right at the beginning, knowing what we're asking, what your guys' expectations are. Makes everything clear, and we're voluntarily agreeing that we have an understanding of what we're going to be doing. We're going to see, how many, when we send the MOU out, how many signatures we get. As I said, we're hopeful that everybody is willing to sign and enter into it with us. We don't know how many are not going to sign it, or, so I think that is kind of step two after we send out the MOU and have the time frame is, okay, for the people that decided not to sign it, how do we move forward? And so I think that we could have that conversation if that question gets brought forward to us, but that hasn't been asked yet. We haven't discussed that internally, and I think that would be a step two of the, you know, communities that choose not to sign it, and then how do we move forward with the non-signers? I guess I don't know, but so not a good answer at this point, but we haven't discussed that yet, and we haven't been asked that specific question.
Thank you. Are there any changes in regard to the sampling methodology or reporting limits?
For the sampling method itself, we're still working with the accredited labs that MDH has accredited for PFAS, so that hasn't changed. We have gotten some good information back on a couple of the parameters specifically about reportable limits, so we're in the process of probably doing some adjustments based on those details that we've been getting back from folks from specific labs. Specifically PFBA, I think, is outside of our desired reportable limit at this point. So we're working on making some adjustments on that, but we're still all going down the path of using the accredited labs with the methods that they are accredited for.
All right, and then somebody has a question that they would like to ask verbally. I think we can do that here. I just want to give some other folks an opportunity to address these questions first, so I will come back to that towards the end. We know that the focus of this study is source removal, reduction. That is assumed to come primarily from SOUs. Why isn't this monitoring focused towards the SIUs directly instead of indirectly through POTWs? OSHA or EPA can go directly to industries for regulation, leaving us out of it and the expense, since we are only receivers of what they are discharging.
So part of the goal for the sampling of PFAS is for us to get an understanding of the concentrations coming into the wastewater treatment plant. So that's part of why we're not just going directly to the SIUs. And a lot of the SIUs we don't have direct permit authority with because they're discharging to the POTWs. So that's part of the reason why we kind of have to use the influent and kind of work through a pre-treatment way to go back to it. The NPDES permit gives you the authority to control users and to work with the users, whether you're a delegated program or not. You have those basic abilities to do that through your NPDES permit. So that's part of the thought process that we have. Definitely a consideration that we've had. We do have some industrial facilities that are doing monitoring through permits that they have, and they've been, it's kind of a mixture of where they're going to do their sampling points, but some of them are looking at doing their processed wastewater that's discharged. But we don't have permitting authority with all of those significant industrial users. So that's part of the challenge that we have because we have no permitting authority with them or don't have a permit with them.
Okay. Thank you for that. I got a couple other questions that relate to cost. I'm going to try to address those at once here. I also, I wanted to give the individual who wanted to ask a question in person that opportunity. Can we unmute Craig Clark from the city of Austin so we can ask his question? We'll give him special treatment because he's from the great city of Austin.
Craig Gray, you mean?
I think it's Craig Gray from the city of Bemidji.
Oh, I saw it as Craig Clark. I apologize.
No problem. A couple of questions and comments that I hope we can have a discussion on. We've been testing for PFAS samples for 3 years. We just completed building our PFAS water treatment plant phase 1. We're under construction of a $17 million water treatment plant phase 2. So unfortunately, we've been involved with PFAS for lots of years. I understand the MOU, the submit a sampling plan, the quarterly sampling, that all makes sense. What I'm not following from the MPCA is develop a source reduction and management plan and then implement the management plan. So a number of questions here somebody from MPCA can perhaps touch on. I'm not aware of any treatment system that will remove PFAS from wastewater, other than, you know, we have $4 million worth of Calgon granulated activated carbon filters, removing it from our water supply. So I don't understand what a PFAS management plan may say. The other thing is, and there was some mention about the limits, we have health-based guidance values for our city water, for all municipal water systems from MDH that we're treating to. Has MPCA established levels for PFAS? It's going to be in every, and we volunteered through a U of M study, and also it's going to be in the wastewater stream. It's probably coming out of your tap. The testing now is so minute and can pick up, I mean, we're talking parts per trillion. And it's all over your household. You wash a frying pan, you're going to have PFAS in that water. And it's going to be below the health-based guidance values for drinking water. I mean, even when we sample, we had to have our guys wear certain types of clothing, and we had to have certain types of gloves. So I'm not following what the end goal of the MPCA here is. We talked a little bit also about finding the source. If you sample the water, and maybe I missed that, if we sample the wastewater plant, that's not going to tell us where the source is coming from, because we have 5,000 service line pipes coming into the trunk mains that then go to the wastewater plant. So I can't envision a scenario where we're all not going to have microscopic levels of PFAS in our wastewater stream. That to me is almost a given based upon what we found out the last 3 years. The point is, there's such small levels, they're not shown yet to cause any harm to anybody. So there's some general questions that maybe some people can comment on. Mainly what do you envision as a typical, what's a PFAS management plan?
And I just want to thank you, Craig, for your question. I apologize for getting you confused with Craig Clark. Just wanted to acknowledge the time. We're almost over time. I'm happy to go a little bit over because this is a important discussion, but I also want to be respectful of PCA's time and other people's time. So if people have to drop off here shortly, we can arrange for some follow-up discussions as needed as well. But thank you for that question, Craig.
Just real quick, if you want me to address some of those thoughts, I can certainly do that. Or if you want to go to other questions, just let me know.
I think, Jeremy, if you want to take some of those, I want to just give you an opportunity to respond to some of those questions if you have some responses, and then I'll take another question or two after that, and we'll try to close out as soon as time as possible here.
Yeah. So the management plan isn't necessarily have anything to do with putting wastewater, treatment, tertiary treatment, any kind of treatment on at the wastewater treatment plant. It's really similar to, like Daniel mentioned earlier, a mercury management plan or a chloride management plan, looking for where that waste is coming from into the wastewater treatment plant so you can remove it at the source. There are, it's way more effective to remove things at the source. We've seen in Michigan that they've had good response by doing treatment at an industry if they need to remove it. The goal for this monitoring plan, and our thought is, we are asking folks that have significant industrial users to start there because we think that they have the highest potential. So that's kind of one of the reasons why the facilities that are asked to be a part of this, they already have kind of an easy pathway to start looking at who might be sending them PFAS in their discharge. So that's kind of the idea with the management plan. And in the data that we collect within that group of PFAS, there's several of them that kind of help fingerprint or point to certain industry types. And so some of the things that are getting developed through our contractor would be, here's the type of industry and here's the type of PFAS that they may be using. So it kind of helps direct folks to certain avenues to look for those. So there's a lot more I could say there, but given the amount of time, I don't want to go too much further down the road, but hopefully it helps just maybe clarify things a little bit.
Yeah, no, thank you. The other thing, Craig, and I appreciate your discussion. I know that you've been dealing with this issue for a lot longer and have, a lot of knowledge on this issue. The other thing I think that is important to know, so the influence sampling, you're right, won't tell PCA or the city specifically where the PFAS is coming from, but it will give an indication as to how much. And I think really the concern here, there's no standards in place at this point for most folks anyway, there's a few out there, but is if there are significant spikes in PFAS concentration coming to a wastewater treatment facility, I think we all collectively want to know that so we can make sure that that stops, so we don't run into an unknown, really bad situation. And so this is where we really advocated for a stepwise approach, where we're starting with that influence sampling, kind of getting an idea about what's out there. And then depending upon what that influence sampling shows, then we'll take steps to address what we find, where it is, et cetera. And there is a lot of uncertainty about all this. And so I think you raised a lot of really important questions, and I appreciate your personal, or your getting on and talking to us. So the last kind of slate of questions that I want to address, there have been several questions around this, is, this is expensive. Our community doesn't have money. We don't have this budgeted. Why doesn't the state pay for this? Why doesn't PCA just hire somebody to do all the sampling to make sure that it's, a uniform sampling process given the complexity here? And I think, I'll take the first stab on that question, is that, so MESR and really the CGMC and the league and others really advocated for funding for that kind of approach at the legislature this year. So to give money to PCA to help pay for this, and ideally help find one contractor to go all around the state, or several contractors to go around the state who are, experts in this type of sampling to do it. And that did not pass. So there is an effort there, and I think that will come back again. And I think what we heard from PCA today is they will leave some flexibility in the MOU so that can still be advocated for those funding, that those resources can, advocated and then incorporated into the process if we are successful in getting those resources going forward. So big concern, great question. I see a lot of other great questions in here. I appreciate that the PCA is responding to some in person. I want to be respectful of everybody's time. I apologize if we didn't get to any of your questions. I know that, PCA has been very willing to answer questions and to address them. So please contact, I know Jeremy and Sherry Bach have been the lead contacts for this. You should all have their contact information if you're involved in this program. So please engage with them. If you're MESRB and CGMC members, please contact us as well. Happy to address this. I think the long and the short about this issue, and to kind of sum things up, is this is extremely complicated. It's one of these, there is a legitimate human health and environmental concern related to PFAS. There's a lot of uncertainty, a lot of unknowns, and this is going to be messy. As it works out, there's going to be a lot of questions that need to be dealt with, and it's going to be messy both on the PCA side and on the municipal side. And I think that's part of solving complex environmental problems. From our perspective, and kind of speaking from the MESRB perspective, the MOU approach is a much better approach, and a stakeholder-driven approach is a much better approach than what we've seen in some other states, where they're really aggressively mandating regulatory requirements and changes to treatment and biosolids processes, where there really isn't a lot of information to do that. And so from our perspective, this more collaborative, stepwise approach, where we're working with PCA and other communities to really work through these issues together and communicating to the public that municipal wastewater is a part of the solution here, we're not a part of the problem, is really important. And, as your individual communities go through and review these MOUs, you have rights to sign them or not to sign them. And if you go down that path and you choose not to sign them, I mean, we'll happy to answer questions. I think PCA will work with you as well to see what are your options if you're not comfortable signing it. But I think that at a very high level, this collaborative stakeholder approach to this type of issue is much preferable than just PCA coming in and saying, you will do this and do it now, because there's so many information gaps around this issue, and it is politically loaded and complicated. And so a more flexible approach, I think is really important. So thank you everybody for attending. Really appreciate it. Thank you for all the MESERB and CGMC members that made it, and for all the MESERB members that really put their time and effort to review the MOU and provide feedback and comments. Thank you to PCA for making the time kind of last minute to be here. We really appreciate your presence. And this meeting will be recorded. It will be available on the MESERB and the CGMC website. And if anybody has any follow-up questions, we're happy to respond as needed. So again, thank you very much, everybody. I'm going to go ahead and sign off now. Appreciate everybody's time this morning.